Now, once you've assessed your client, and again, we've used the modified Thomas test in this video. However, we'll also look at standing posture, we'll look at squatting, we'll do some muscle testing and other ranges of motion. So it's not just the modified Thomas test we'll assess. And you've determined that your client has short, tight, maybe hip flexors and or hip rotators and or hip extensors. We want to do our myofascial release. So we've already done our myofascial release around Sarah's hip to release TFL, sartorius, and rectus femoris. So now we're going to teach Sarah how to optimally align her thoraco-pelvic cylinder, because remember, that's the attachment of the psoas. It's also the attachment for the glutes, because the glutes are attaching up into the pelvis, and that thoracolumbar fascia and the lats. So that thoraco-pelvic cylinder is a very important part of activating the psoas and glutes appropriately. Our first go-to corrective exercise pattern is the happy baby supported position. Happy baby position is just the baby position as they're lying on their back. The supported position refers to the feet being supported on the wall or on top of a bench or block. The feet are about shoulder width apart, and the reason we like this position is because it helps the client align their head and neck and thoraco-pelvic cylinder throughout the pattern. It helps them relax the hips because the legs are supported on the wall, so the client doesn't have to use their hip flexors to maintain this position. And it also allows the individual to be in their most relaxed position. If your client does not do well on their back, you can also do this in quadruped. You can do it in the supine position, and you can also do it in the side lying position. So choose the position that allows your client to be the most successful without compensating and without creating any kind of discomfort. It's really the position that allows your client to be the most relaxed. And obviously, if your client can only sit in a chair, they can't get down on the floor or onto a table, then do it in a sitting position. However, everything we use in the lying position here will apply to those other positions. Once we've got our client aligned, our next goal is breathing. We want to teach our client how to create their most optimal and efficient three-dimensional breathing strategy. And what we refer to, or what we mean by three-dimensional, is the ability to use the entire thoraco-pelvic cylinder, thorax, abdominal region, and pelvis in the breathing process. It's not just belly breathing. Belly breathing is not diaphragmatic breathing. Three-dimensional breathing is using the diaphragm, the psoas, the pelvic floor, and all the intercostal muscles, all the muscles of respiration in the breathing process to ensure that your client has the ability to use each region of their core in the breathing process. And this is really how you create a more optimal and efficient posture and movement strategy, as well as make sure or ensure that your client has the most optimal strategy for whatever activity they're doing, everyday life, as well as when they're needing to breathe when they have their core braced, when they're lifting or running or exerting a lot of energy or force. So we start our clients by breathing first down into their lower abdominal region, because that way they start to release the hips. They also release the low back, because a lot of our clients don't get their breath far enough down that direction to activate the psoas appropriately or the pelvic floor. This is a great way to teach your clients. They breathe into their fingers. It's a great way to teach them how to start to release their pelvic floor and release their hip rotators and the tightness around their hips, and release a lot of that chronic low back tension as well. They'll perform 3 to 5 breaths, breathing through her nose as she's breathing, and then we'll move her into the next section, our next area, which will be her rib cage. The next aspect of three-dimensional breathing is we got her breath top to bottom, all the way down towards her pelvic floor and her sit bones. Now we want to get her breath side to side. A lot of our clients have a very rigid rib cage, so they're not expanding the ribs in that bucket handle sort of fashion this direction. They're just breathing, or they're breathing up here. They're not actually getting nice expansion and relaxation of the rib cage. So we'll have our client place her hands upon her rib cage right below her chest, and she'll breathe laterally, side to side, into her hands. And then as she breathes out, she'll focus on lowering the ribs down towards her feet that direction. So her ribs are opening up as she breathes in this direction, and then her ribs are relaxing back down towards midline and towards her feet as she breathes out. So again, 3 to 5 breaths in this position, and this is a very powerful position because this is where the QL is coming up from the pelvis to those lower ribs. So when your client can get their breath into their rib cage, they really relax a lot of that chronic mid-back tension. the ribs being overcompressed by the QL, by the erectors, and by that overextended type position. So this is a very key aspect of helping your clients with their thoracic mobility as well as their lumbar spine mobility, especially those clients that have that very extended type posture and that chronic mid to low back discomfort. The final area you want to direct your client's breath is more front to back. And most of your clients will struggle getting their breath front to back. And this is so important because right back here, the lower ribs, right around the lower ribs, and the upper lumbar spine and lower thoracic spine is right where the posterior aspect of the diaphragm attaches. And the psoas is fascially blending up into the diaphragm through that region, and the transverse abdominis is wrapping around and fascially blending into this area. Most of your clients struggle getting their breath there because if they're especially tucked into posterior pelvic tilt and lumbar spine flexion, or they're overextended and then sway back, they're overcompressed through their mid to low back, and they don't breathe well into their mid to low back, hence the reason they always feel chronically tight and why they keep having to pull themselves into this position, which just perpetuates the tightness. Getting the breath front to back through that region is the most effective strategy to release chronic tension and to restore optimal use of the diaphragm, the psoas, and ultimately the transversus abdominis as well. So we'll use a strap that Sarah has just wrapped snugly but not too tightly around her rib cage, right around that lower rib cage and lower thoracic area of her spine. So she's just pulled that strap taut around her abdomen, not tight where she's cutting into the skin, but just taut so she can feel as she breathes into that strap. It gives a great proprioceptive feedback for the individual to feel where she needs to breathe into. And now she'll send her breath into the strap and then release and relax those ribs as she breathes out. So she's breathing all the way around into her entire rib cage, front to back, side to side, top to bottom, into the strap. The strap provides, again, that nice proprioceptive feedback to ensure that she's expanding into the ribs and she can feel herself breathing into that posterior and lateral aspect of the rib cage, so the backs and sides of the rib cage, where so many clients struggle. And when you really improve this aspect of your client's breathing, you really improve mobility as well as stability because you activate the diaphragm, psoas, transversus abdominis, and you activate that deep stabilization system, and you create the mobility because now your client doesn't have to overuse those superficial muscles in their stabilization response. So I hope you enjoyed this video, and I hope it explained how to look at the psoas length in your clients, especially using that modified Thomas test. And of course, as I mentioned earlier, you want to use other assessments. You want to use posture, movement assessments, squats, and or bending positions. You want to use your range of motion and or muscle testing as ways to gather more information. And then you want to use your corrective exercise strategy. So the strategy I shared with you in this video and that we're sharing with you in this 4-part video series is the integrative movement system approach to posture and movement, where first you use your assessments to identify your client's non-optimal and inefficient posture and movement habits. And then 2, you use this information to then strategically release and activate. So you want to release superficial hip flexors like TFL, rectus femoris, and or sartorius, superficial erectors, and or glutes to release some of the gripping patterns that your clients have gotten into by pulling their abs in or squeezing their glutes. Release the myofascial restrictions, and then use your corrective exercise strategies to create and develop more optimal alignment and breathing. So we showed you demonstrated the happy baby position with breathing and how we teach 3-dimensional breathing, true 3-dimensional breathing, not just belly breathing. It's using the entire thoracolpelvic cylinder, top to bottom, side to side, as well as front to back, to activate the diaphragm, its connection into the psoas, and the psoas' connection into the pelvic floor, and to integrate that with all the respiratory muscles so we reinforce the alignment we ultimately want our clients to be in. In part 3 of the series, we'll come back and I'll demonstrate how do you take this into the upright position. So our next most common corrective exercise pattern to reestablish optimal alignment breathing and now develop a higher level of control. So your client is able to use their psoas and glutes as part of the entire system and integrate that into a very functional pattern to improve hip as well as low back function and stability and keep your clients from experiencing that chronic tightness oftentimes eliminate a lot of the chronic low back pain they're experiencing, and also those inefficient posture and movement habits, and move them successfully towards accomplishing their health and fitness goals. Thanks for watching. We look forward to seeing you in part 3 of this series. This is Dr. Evan Osar. Make it a great day.